This is Dr. Jonathan Rubenstein. I want to talk about prostate biopsy coding. January of 2026 is going to be a big change from how prostate biopsy codes were originally used. So I'd like to get to it right now. The code set for performing prostate biopsy procedures is going to be changed. The most commonly used code, CPT code 55700, which describes prostate biopsy any technique, is going to be deleted. That's the code that's been used most commonly for decades. And typically, a diagnostic ultrasound or an ultrasound needle guidance code is additionally reported with that code. That's how biopsies have traditionally been done. The updated code set will actually keep CPT codes 55705 and 55706, although they will be slightly updated. So it's important to know that. And the code will be added with a number of new CPT codes, actually a total of 9 new codes, and each code will be unique based upon its approach, such as transrectal versus transperineal versus like an in-gantry CT scan or MRI guided prostate biopsy. The codes will be chosen based upon whether MRI fusion guidance is also being performed at the same time or not. And this code set also has add-on codes. So many radiology codes, an additional code for additional lesions will be used when more than one lesion is being biopsied, and that'll be true about the updated code set. So it's important to understand the add-on code. What's new about this code set is imaging is included. As I mentioned before, with code 55700, typically a diagnostic ultrasound or an ultrasound needle guidance code is additionally coded in addition to the biopsy itself. The new code set, all diagnostic imaging and imaging guidance is included, will not be reported separately. So with the new code, one will not report a diagnostic ultrasound or a diagnostic MRI or needle guidance code along with these new biopsy codes. So basically, one CPT code will be submitted for billing purposes, which would encompass basically the entire procedure that's being performed when biopsies are being performed. So here's the code set. As I mentioned before, CPT code 55700 is going to be deleted. CPT 55705 is updated to now describe any non-imaging guided prostate biopsy, such as a finger guided biopsy. 55706 is going to remain about the same, which is a transperineal stereotactic template guided saturation sampling. And so saturation biopsy is a very unique procedure where the entire prostate is mapped out using a grid. Uh, and this is really indicated in people who have had a previous prostate biopsy that is either suspicious or maybe the PSA is rising. And now this is another set of biopsies that needs to sample the entire prostate. Again, how it's mentioned and how it's done is probably not too commonly done these days, but that code will still exist. So then the 9 new codes will be 55700, 55707, excuse me, which describes a transrectal ultrasound guided biopsy of the sextant areas of the prostate and any other ultrasound localized discrete lesions or other areas that are going to also be biopsied. Let's say somebody wants to take some extra biopsies out of an anterior area, a transition zone, or a seminal vesicle, or a hypoechoic lesion is seen on diagnostic ultrasound. That will all be included in CPT code 55707. 55708 is just like 55707, but in addition to the sextant biopsies, it will also include MRI fusion guidance. This MRI fusion guidance will include the first targeted lesion. If an MRI, which has previously been performed and read, has one lesion, and a sextant biopsy performed along with the MRI fusion guidance of that first lesion, CPT code 55708 will be reported. For additional lesions, the second lesion or third lesion, the add-on code 55715 would additionally be reported. CPT codes 55709 and 55710 are similar to the previous two codes, except this goes by the transperineal route. Transperineal route is a different approach, slightly different equipment, and that's why separate codes are needed for that approach. 55711 and 55712 are for an MRI ultrasound fusion guided biopsy where only the targeted lesions are being biopsied without, say, a sextant biopsy. And so that would be a transrectal and transperineal approach, respectively. 55713, 55714 will be in-bore CT scan or in-bore MRI guided. The 55713 will include the sextant biopsies, and the 55714 would be only if targets were being biopsied. The 55715 would be each additional MRI fusion or in-bore CT or MRI guided lesion after the first lesion. The first lesion is included in each of the above codes. So again, let's look at it from this direction. 55707 and 55709 is when an ultrasound-guided sextant biopsy is being performed, and along with any other areas that might be localized by a transrectal ultrasound at the same time. The 55707 is the transrectal approach, 55709 is the transperineal approach. So again, the sextant biopsies, which is a typical way of performing biopsies, typically there's three on each side, and two biopsies are taken from each of the three sections on each side, the right and left side of the prostate, and that's all included. And if during the course of doing this, those sextant biopsies, additional sites, transitional zone, anterior seminal is also being targeted and biopsied, or any hypoechoic lesions, that's all included in these codes. And again, all imaging, both diagnostic and needle guidance, is included, so will not be reported separately. 55708 and 55710 are the sextant biopsies along with MRI fusion of the first targeted lesion. The 55708 is the transrectal approach, the 55710 is the transperineal approach. And again, the sextants are included, and the first MRI fusion lesion, no matter how many cores are taken, is included in these two codes. Now, if the diagnostic MRI, which had previously been performed, shows a second lesion or a third lesion, and those are additionally biopsied, one can report add-on code 55715 for targets number 2 or number 3 if they are additionally biopsied. And so targeted lesions are counted per lesion, no matter how many cores are taken from that lesion. Because typically one does take multiple cores from each lesion, but this is counted per lesion, not per biopsy taken. 55711, 55712 is that the MRI fusion biopsies are performed without the sextant biopsies. The 55711 will be transrectal route, 55712 is transperineal route, and again, the first targeted lesions included. Additional targeted lesions would be reported using add-on code 55715. 55713 and 55714 are in-bore CT scan or in-bore MRI guided biopsies. Those are typically done on the machine itself, on the CT scanner, on the MRI scanner. 55713 would be reported if the first targeted lesion plus sextant biopsies are also performed. Again, with add-on code 55715 for additional targets if they're targeted. 55714 will be the first lesion if no sextant biopsy is being performed. And again, with this add-on code 55715 to identify each additional targeted lesion. So then this add-on code 55715 is described as being used to report additional targeted lesions that are seen on the pre-procedure MRI, which then an MRI ultrasound fusion or an in-bore CT scanner MRI guidance is used to biopsy additional targeted lesions, understanding that the first targeted lesion is included in the base code. And again, this code will be used once per additional lesion, no matter how many biopsy cores are taken from that lesion. And so therefore, this would be used on the Codes with MRI ultrasound fusion, such as 55708, 55710, which are the codes which include sextants, 55711 and 712, which is the MRI fusion of the target only without sextant biopsies. 55713, 55714 are in-bore CT scan or MRI guided biopsies. And so here's a summary slide based upon the procedure. You know which CPT code to choose. Standard trust biopsy, which is the sextant or 12 core biopsy, one would report 55707. If you do the sextant transrectal biopsy and additional biopsies, say at the transitional zone, seminal vesicle, anterior lesion, or any hypoechoic areas, that still will be reported with 55707 without any additional codes added onto it. If one were to perform a transrectal ultrasound biopsy, such as the sextant, plus MRI fusion of the first lesion, even if multiple cores are taken from that lesion, it would be 55708. For that same procedure, let's say there were two lesions that need to be biopsied. Again, this is when one would use 55708 plus the add-on code 55715. If a patient had three lesions that need to be biopsied, 55708 and use 55715 twice. If one is performing a transperineal ultrasound guided biopsy, which is typically a sextant or around 20 cores, 55709. And similarly, if additional lesions are also seen and additional areas biopsied, it still would be 55709 if added on to that. But the transperineal route plus MRI fusion, so let's say the sextant plus the first lesion, 55710, transperineal plus MRI fusion of the sextant, the first lesion, and now a second lesion, 55710 plus 55715. Transrectal ultrasound fusion biopsy without sextant and first target be 55711. Similar procedure, but let's say there's two targets, 55711 plus 55715. Transperineal route, let's say two targets, 55712 plus 55715. The in-gantry codes, again, these are just examples. If just the targeted lesion, first target lesion plus a sextant biopsy with 55713. And let's say there was no sextant but two target lesions, one would use 55714 plus 55715. And the non-imaging guided biopsies, let's say somebody does a finger guided biopsy, one would report 55705. Thank you.